Numbers from the CDC, tuberculosis rates rose 16% last year. The third straight year cases of the bacterial infection rose after almost 30 years of being on the decline. The agency saying the rise may be an effect of the pandemic, which disrupted efforts around the world to prevent, diagnose, and treat TB. With more on this TB spike and other medical news of the day, we are joined by board-certified ER doctor, Dr. Michael Daignault. Always good to have you.
Thank you.
You were here last week talking about the fact that California doctors received an urgent to be extra aware, if you will, of the TB that's circulating, and then you had your first case here in Southern California that you treated. What is the significance of that?
Right, Marla. So just last week, we were talking about that alert that went out to all the doctors that we had to have a higher index of suspicion in tuberculosis, especially in patients that come to the ER that are not necessarily from the United States. And what this alert also highlighted was to be on the lookout for people that have been in prison or in assisted living facilities, congregate setting, because they were at a higher risk too. And so my case was actually a patient that had recently got out of prison, now in a drug rehab facility, that tested positive for TB on a blood test and came to the ER for a chest x-ray. So fortunately, the chest x-ray was negative. So what does that mean? It means that she was probably exposed to TB, infected, but fighting it off. And so now they'll have to discuss, with an infectious disease doctor whether she needs to be treated. So right after that alert, seeing a patient in the ER, all the doctors in the ER across the state should be on high alert for this.
Okay, and then moving on to measles, more measles this year than all of 2023 in the last, few weeks?
Yeah, we've already surpassed the total number that we saw in 2023, and it's only March. And the reason for this is the outbreaks in Philadelphia, Chicago, and Florida. And the clear reason behind this is unvaccinated kids who traveled internationally and then came back here. And as I've mentioned before, this was the first year that the rate of measles vaccine in kindergartners was under 95%. It was only 93%. So what that means is we don't have herd immunity anymore. So basically just a few cases will spread amongst a lot of those kids that are unvaccinated.
And that's sort of a result, I would think, from the pandemic and vaccine hesitancy.
And misinformation around vaccines definitely contributed to that.
Okay, so Ozempic babies, this, I've seen headlines, in the last couple of days.
Yeah.
What in the world is happening? So women are surprisingly pregnant who are on, in other words, they didn't intend to, or they may be on birth control, and they're getting pregnant, and they happen to be taking Ozempic for weight loss. So is this by chance, or is this a mechanism of the drug?
It just goes to show you there's still a lot we don't know about these drugs. So there's two possible mechanisms. So when you have an excess amount of fatty tissue, you're overweight, that's an inflammatory chronic process, and that influences the level of hormones in the body. So when these women are taking Ozempic, Wegovy, they're losing a lot of weight, the hormones are able to regulate themselves normally, and previously women that have had issues with infertility are suddenly finding out that they're pregnant. The other possible mechanism when you look at drugs like Zepbound, which is different than Ozempic but kind of works the same way, is that it slows the rate of processing digestion of the oral contraceptive drugs that people take. So people that are on oral birth control, which this week is now available throughout pharmacies in California and the rest of the country without a prescription, totally over the counter. You don't have to talk to a pharmacist. So, those are two possible explanations right there that I don't think this is by chance. There's clear mechanisms for how this is potentially happening. Okay,
so what is your final word to females out there who are on Ozempic?
Whether it's Ozempic, Wegovy, Zepbound, you really have to pay attention. You have to talk to your doctor. And the companies Novo Nordisk and Eli Lilly have just set up a website where women that are on this need to learn more information about potential chances of becoming pregnant, and that you need to stop taking these medications if you do become pregnant. So definitely follow up with the manufacturer on that.
We need to do a deeper dive into this one.
There's still so much we don't know.
Okay. Dr. Michael Daignault, thank you so much.
Thank you.
Have a great weekend. Alex, over to you.